Hello everyone, welcome back to Dr. Coder's medical coding classes. So today I am doing part 2 video of compliance and regulatory practice questions, that is Hipaa practice questions. Hope part 1 was helpful for you. If you haven't watched that video means you can also watch that. Now let me move on to question. First question. Submitting separate claims to insurance provider for services that could fit on a single bill is called A. Upcoding, B. Undercoding, C. Unbundling, D. Falsifying medical records. So here the question is, for services that will be fitting in a single bill, it will be coded as separate. Okay, separate claims will be there. What is that condition is called? That condition is called unbundling, which means they are in a single bundle which are coded separately. So unbundling. Okay. So this service is called unbundling. It comes under fraud and abuse. Okay. So our answer is C. Okay. Then what is upcoding? We have already seen in the last practice questions. Then what is undercoding? It is the opposite of upcoding. Okay. Now moving on to the second question. When are providers responsible for obtaining an ABN for a service not considered medically necessary? What is ABN? Advanced Beneficiary Notice. So the question is when you have to sign the ABN document. Whether after providing service to beneficiary, that is the first option, after providing service to beneficiary. B. Before, prior means before, prior to providing service to beneficiary. C. During service. D. After denial has been received. So what is ABN? ABN, it is a written document which is given, provided to the beneficiary, and it includes services that are not covered. Okay, and it should be signed before doing the service. So the answer is B. Prior to providing a service or item to beneficiary. Okay, what is ABN? It is a written document which is given to beneficiary. It includes the services which are not covered, and it should be signed before, it should be given before performing the service, prior to performing the service. So the option is B. Now third question. CPT code updates are published in A. Once per year in early fall, B. Every year in July, C. Every other year in January, D. Twice per year. Answer is A. Once per year in early fall. Nothing to again. Fourth question. This entity develops and publishes an annual plan that outlines Medicare monitoring program. So which is that entity which develops and publish annual plan that outlines Medicare monitoring program? First option A, MAC, Medicaid Administrative Contractor. Then B, FIs, COIG, Office of Inspector General, and D, CMS, Center for Medicare and Medicaid Services. So the answer is COIG. The next question, what is NPI? NPI. A. National Payer Incentive. B. National Provider Identifier. C. National Provider Index. And D. National Payer Identification. So NPI stands for National Provider Identifier. Okay. Now what is NPI? NPI is actually unique identifiers. It is used for tracking providers such as private clinics, hospitals, nursing facilities, and all. Okay, so NPI stands for National Provider Identifier. Now moving on to next question. Surgical Global Package applies to services performed in what setting? What is Surgical Global Package? It is a single payment for all care associated with a single procedure. Right. Now, the Surgical Global Package is applied to service performed in what setting? That is the question. A. Physician office. B. Ambulatory surgical center. C. Hospital. D. All of the above. Okay, among the options, for what the surgical global package is applicable? That is the question. The answer is all of the above. Whether it is in physician office, whether it is in hospital, whether it is an ambulatory surgical center, surgical global package is applied. Next question, what type of insurance is Medicare Part D? Now, what is Medicare? We have already discussed in the previous practice questions, right? Medicare was a program set up by the federal government in order to help for the people above aged people above 65 years and young people with disabilities. Right? This Medicare is composed of four Part A, Part B, Part C, Part D. Okay, of which Part D covers what? A. Medicare Advantage program managed by private insurance. B. Hospital coverage available to all Medicare beneficiaries. C. Provider coverage requiring monthly premium. D. Prescription drug coverage available to Medicare beneficiaries. The answer is Part D covers prescription drug coverage available to all Medicare beneficiaries. Okay. This prescription drug coverage includes the prescription drug cost and that is paid by the monthly premium of all Medicare enrollees. That comes under this prescription drug coverage. Next one, which of the following is a benefit of electronic transaction? A. Payment of claims. B. Security of claims. C. Timely submission of claims. D. None of this. The answer is timely submission of claims. Okay, electronic transaction have the benefit of timely submission of claims to insurance carriers and proof of transmission of the claims. Okay, timely submission of claims means claims will be submitted on time. Then ninth question, PHI. PHI stands for private Hipaa information, personal health information, protected health information, personal health insurance. What is PHI? PHI comes under Hipaa and it is the information. Okay, past, present, or future physical or mental health condition of the individual. Okay, it is that information about the past, present, future physical or mental health condition of the individual. Okay, now this PHI stands for protected health information. It is information about the physical and mental health, so it will be health information only, right? And it is protected, so the answer is protected health information. Next question, question number 10. A federal law that requires employers to offer continue insurance coverage to certain employees and then their beneficiaries whose group health insurance coverage has been terminated. What is this federal law called? Okay, what is the question meaning? It is an insurance coverage which is provided to employees whose group health insurance coverage is stopped, is terminated. What is that condition called? A. Chambers, B. Tricare, C. Blue Cross Blue Shield, and D. Cobra. So the answer is D. Cobra. Okay. COBRA stands for Consolidated Omnibus Reconciliation Act. Under this act, even if the employees are terminated, they can receive their insurance for up to 18 to 36 months. Okay. Next question number 11. This program was developed by CMS to promote national correct coding methods and to control inappropriate payment of Part B claims and hospital outpatient claims. A. NCCI, B. NFS, C. Hipaa, D. MAPA. Answer is A. NCCI, National Correct Coding Initiative. 12th question, ABN stands for, we have already discussed. A. Advised Beneficiary Notice. B. Advanced Beneficiary Notice. C. Artificial Benefit Notice. D. None of this. Answer is Advanced Beneficiary Notice. What was Advanced Beneficiary Notice? It was a written document that is given to the beneficiary prior to performing service that these services will not be covered. Okay. Next question. Medicare program is made up of several parts. Which part is affected by the Centers for Medicare and Medicaid Service hierarchical condition category CMS HCC? So I have already said what is Medicare. It is again I'm telling so that it will be by heart for you. Medicare. It is a program conducted by the federal government in order to um, give insurance coverage to old age people like persons above 65 years and also young people with disabilities, and it is made up of four parts: part A, part B, part C, part D, of which CMSHCC comes under part C. So the option is part C. Next question. In what year was the AAPC found? A 1956, B 1980, C 1965, D 1988. So answer is 1988, option D. Okay, so we have 2 years here. First one is AAPC founded in 1988. Second one, Hipaa was made into law in 1996. Okay. Next one, CMS. CMS stands for Center for Medicare Service, Centers for Medicare and Medicaid Service, Center for Medicaid Service, Center Medical Service. So answer is Center for Medicare and Medicaid Service.